Emmetropes make up a huge subgroup of our patients. They really have no reason to think about their vision because it's just good all the time. But we have all seen the absolute devastation that comes upon them when presbyopia catches up. When a patient's amplitude of accommodation dips below their reading distance, they become very frustrated. At first, they may turn to over-the-counter reading glasses, and for many of them, this option initially seems suitable. But for others, they get frustrated by glasses on and glasses off that they must endure. When an emmetrope comes into the office, they want to hear that they can return back to the vision of their 20s with either glasses or contact lenses. But that news just doesn't exist. Whether they have to go to glasses or contact lenses, perfect vision is just not available. With glasses, they either are going to have to compromise with readers or utilize progressives, which limit the field of vision that they're used to. When it comes to contact lenses, we eagerly offer them to our emmetropic patients. But doing so always requires setting the proper expectation. First, we share with them that in order for them to see, they'll have to go through some level of compromise. In order to understand what that level of compromise is going to be, we like to do a swinging lens test with a +2 trial lens while the patient looks at a distance chart. We simply ask the patient to tell us what's happening. If they give us a strong dominance or no dominance and are accepting the lens in front of either eye, then we know we can do modified multifocal vision for them. Other tools are available that allow us to understand more about our patient's vision with the varying amounts of pupil diameter and add powers that they may have. This simulator here allows us to see the visual acuity changes that will happen by increasing the power or changing the zone size of the patient's contact lenses. These types of tools from our industry supporters allow us to have a better understanding early on of what the level of compromise may be for our patient's vision. We tend to avoid straight monovision for our patients unless the patient has previous experience in it because of the limitations that it gives at some or many distances. We may start an emmetrope off in a modified multifocal vision using a multifocal lens in the non-dominant eye or least dominant eye. Our goal is to have them experience some level of improved near vision. In doing so, we don't recommend showing them the distance chart, but rather their cell phone at first, because their near vision is what they're complaining of the most, and if we can share with them how it's better at that distance, then we can allow them to adapt and experience a modified distance vision. As they progress in their contact lenses, most emmetropes become more and more aware of what contact lenses can do for them, and that their distance vision will be compromised. They'll either slip back into full-time readers or adjust to monocular, or in most advanced cases, binocular multifocal vision. There's certainly a challenge, but the use of contact lenses for emmetropes is definitely a good idea, and with the proper hand-holding, can help to improve the quality of their vision and life, and ultimately, that's why we do what we do.